I'm Erica Kaufman West. I'm an infectious diseases physician with the Franciscan Physician Network.
And today we're here to talk about measles and why are measles suddenly making a comeback?
I think this has sort of been in the process of occurring for several years. So the current outbreak and outbreaks in general typically occur because there are pockets of the population, typically small communities, whose vaccination rates have dropped below about 92 or 93%. And once you get below that threshold, the notion of community immunity, which they used to call herd immunity, that goes away. And that protective effect of everyone being vaccinated and immune, without that, then these outbreaks can take hold in these populations.
Right. So recently, the news came out that we're at a 33-year high for measles cases.
Yeah.
And so what sort of factors are building up to that? Obviously, you know, as you mentioned, there's the drop in below that 93% threshold, but what's contributing to that?
Well, I think that there's the, COVID pandemic did not help things when office visits were shut down and pediatric practices weren't, able to see all of the children for their well child visits. We have children who are still not caught up yet with their routine childhood vaccinations. So there are, very well-meaning parents who still are just working hard to get their kids caught up because they missed 1, 2, 3 years of vaccines. So I think that did play a role. I think that there is also the role of misinformation and disinformation that's out there now, partly just with social media and the ability of people to sort of get into an echo chamber where you hear one thing and then you just keep hearing that over and over and over again just because of the way that these social media algorithms work. And so I think that is an unfortunate side effect. There are many benefits to social media and the community and camaraderie that you can experience there, but it can also be very isolating. And so I think some people have real just questions about what is a vaccination? What is my immune system? How does this affect my immune system? And you can get to really great information that's helpful and very well researched and can explain it in a nice and easy way. And then there are, people in areas out there in the internet that are just not as helpful and can actually sow some pretty bad disinformation, that vaccines are dangerous, that they're going to, cause irreparable harm to children. And obviously, no parent wants to put their child in that type of situation. And so I think that there has just created this milieu of confusion for people. And I think, physicians need to do their best to try to answer those questions. But it's become a hot button, I think, for a lot of people.
Exactly. What can we do to help put parents' fears at rest?
The immune system is so incredibly complex that, it is its own specialty within medicine. I mean, there are immunologists who spend their entire training and careers understanding how the immune system works, how it interacts with the rest of the body, how it reacts to things that we are exposed to. So I think physicians should not feel like they have to be experts before they can engage in some of these discussions. Most parents are looking for sort of the basic understanding of what an immune system is and what a vaccine does. I think it's really helpful to explain to people that, the immune system's job is to protect us from foreign invaders and that your immune system is working all the time. It's creating antibodies every minute of every day. It is fighting off different bacteria and viruses that you come in contact with just in the routine, walk through the grocery store. So your immune system is not just sleeping until the vaccine gets into your arm, right? Your immune system is constantly working. And vaccines are one way to get the immune system to have a very specific response so that if you're exposed to that disease, bacteria, virus in the future, it's ready to go. And so back before we had vaccines, people developed natural immunity to measles and mumps and smallpox and those kinds of things because they would be exposed to it. They would develop the immunity, and then when they were exposed to it again, they either wouldn't get it or it wouldn't be so bad. And so the vaccine is just providing that first primer so that you don't have to get sick. We're just going to teach your immune system how to respond to this if it sees it again. And I think when you sort of explain it that way, it makes it a little bit easier for people to understand that we're really just providing what is a very natural reaction in the immune system. We're just helping it have a specific response to a specific pathogen. I think there's been a lot of concern about what goes into vaccines, right? And there was unfortunately a study that was later retracted because of a lot of just bad research. And it brought up the possibility of a link between autism and the measles, mumps, rubella vaccine. Because of that, the medical community rightfully looked into this for decades to say, is there a possible link? Is there something in this vaccine or other vaccines that might be causing some damage to children? And it has never been shown time after time looking at millions of doses of vaccines. And so I think that has done a lot of damage. And I think that the longer that those things keep being talked about, then the harder it is for physicians to undo that damage.
Talk about a little bit about the effectiveness of the measles vaccine.
Yeah, so the measles vaccine is incredibly effective. So so in the U.S. we have a recommendation of 2 doses of measles vaccine. Typically, it's given in an MMR, measles, mumps, rubella, or MMRV, measles, mumps, rubella, and varicella vaccine. So 1 dose of that is 93% effective at preventing measles, which is great. And then 2 doses is 97% effective. And that boost, that 4% boost, is why the recommendations, decades ago when the measles vaccine came out, increased from just the 1 dose to the 2 because that increase in efficacy. Most of that is started out when you're 1 year old. So it's a pediatric vaccine typically. And so that helps provide that community immunity because when you're less than 1, you don't have any, immunity to measles. Um, you know, so it helps those most vulnerable.
Can we talk a little bit about the ingredients in a vaccine? And I know that's a cause for a lot of parents' concern is what else is in there, and can we talk a little bit about what is done to um just identify make sure that there's relatively safe ingredients involved?
Yeah. So again, because of that initial thought in the early 80s that there could be a link to vaccines and any ill effects, there's been a lot of interest in paring down what goes into vaccines. So when vaccines were first developed, they were mostly given from multi-dose vials. So you'd go to your pediatrician's office and there would be a huge bottle and they would access it just over and over and over again. And you might be able to get, I'm making up a number, 50 vaccinations out of one bottle. And that was fine. That was the best we could do at the time. There's obviously concerns about contamination of those bottles with bacteria and other viruses. And so we have made the move to single dose vials in the US. We're a wealthy enough country that we can do that. And so those single dose vials, it's given to one person, it's thrown away, that's it. Nobody else gets access to it. And so when you go from a multi-dose vial down to a single dose vial, a lot of the preservatives that you needed for the multi-dose vial, because it had to last, weeks and weeks till you could get all of those doses given, you don't need those anymore in the single dose vials. And so a lot of the, concerns of, hey, what else is in there, have been alleviated by the fact that we do go to single dose vials. And so we have also improved our preservatives to the point that we don't use mercury containing preservatives anymore, and things are really just pared down to as minimal of ingredients as are needed in order to get that vaccine into the arm.
So a question that I see a lot from parents is a fever, is a cough. How serious is that? I mean, at the surface level, yeah, it sounds like a hassle and, just like another childhood illness, but can we talk a little bit more about the effects of measles?
Yeah. So if measles was just a fever and a rash, then I don't think there would be this kind of concern, right? We really make vaccines against things that can cause pretty bad damage, whether that is, disability like polio, or whether that's actual death. So measles carries a decent rate of complication. So about 1 in 20 children who get measles will develop pneumonia. And pneumonia is the most common reason kids die from measles because it causes such a severe inflammatory response in the lungs. Encephalitis, which is the medical term for brain swelling, that occurs in about 1 in every 1,000 children who get measles. And that can cause seizures, and it can also cause permanent intellectual disability. So obviously something that we want to try to avoid. And so with those types of rates, we would see, several, 100 children die of measles in the U.S. because before we had the vaccine, just because it's such a contagious disease, it would just rip through communities. There's also two other complications I would like to mention. Most of those look at children, but pregnant women, if they get measles, they can have poor birth outcomes. So they can have premature births or infants that are born with low birth weights, which can cause complications for those babies down the road. And then there's a really scary complication called subacute sclerosing panencephalitis, or SSPE. And it is very rare, especially now that we don't see a lot of measles cases, but it's pretty terrifying because there's no treatment and there's no cure, and it occurs about 7 to 10 years after the person recovers from measles. It seems to occur more if you get measles young, like before 2 or 3 years old. But you can recover, everything can seem to be going fine, and then 5 to 10 years later, you can get this really severe neurologic damage that is eventually fatal, faster or slower, depending on some supportive care that we can do. But yeah, there's no cure for it.
Wow, that's kind of frightening, actually. Growing up where we had chicken pox, and now our generation is like, okay, now we're getting shingles. Are there other long-term effects that may be possible if you had measles as a child?
I mean, I guess it's possible. We started the vaccination effort in the mid 1950s, early to mid 1950s. So I think people that got measles sort of naturally are starting to get up there in age. They're going to be 70, 80 years old. So any effects that we would have seen would have played out in that population already. I don't know of anything, again, besides the SSPE that happens as sort of a long-term effect of measles. And hopefully, fortunately, we won't have to worry about that if we can keep our vaccination rates up and have less people actually getting measles as a disease.
And of course, we're getting back to school very quickly. For us,
Mhm.
it's in 2 weeks. Um, what do we do if we get that note from school saying, "Hey, Jane had in your class had measles." What should parents be on the lookout for? Should they be concerned? Is it at that point, is it too late for us to get a vaccination?
Um, Sort of depends on how old that child is, right? So in a daycare, we're much more concerned because you have children that maybe haven't been vaccinated or are not fully vaccinated with those 2 doses yet. So that's a big concern. Typically, the health department is involved in these cases, and they're the ones that, help facilitate those notices home. Um, for parents, especially parents who have children who are not vaccinated, the recommendation would be to vaccinate the child because hopefully we can get some immunity in before the virus sort of replicates enough to cause disease. So that will sometimes be a recommendation. For parents who have children who have autoimmune diseases or other immunocompromising conditions, they may have to keep their children home in quarantine for 14 days to look and watch for signs of disease and symptoms, and to avoid spreading it around. So there are some real implications to those exposures for parents, just in terms of even having to stay home for 2 weeks to keep the children in quarantine.
And if your child does come up with these symptoms, I mean, obviously it's pretty easy to discount a cough or a fever, but that telltale rash,
Right.
what should they be doing?
So first thing to do is to, especially if you've been notified of an exposure, maybe from another parent as opposed to, a health department official, is to call the pediatrician and say, hey, my kid was exposed on this date at this type of event. If it was a birthday party, for example, just so that the physician can then contact the, local health department so that they can make sure that everybody that's been exposed is being monitored. If you do see the fever and then you get that rash that starts at the hairline and then just spreads sort of down and out, then I would also call the physician and just say, look, this looks like measles to me. A lot of physician offices nowadays do virtual appointments, so you don't even have to go anywhere. They can look at the rash via the camera, even just on a phone, and they can say, yeah, you're right, that looks pretty suspicious. If they feel like the child needs to be seen, they will often have you come in a back door so that you don't sit and wait in the lobby and expose other babies and children to measles. And the same thing with an emergency department. If the child, who had been doing well and is eating and drinking and doing all those things, stops doing those things and emergency care is needed, again, it's important to call the emergency department first and say, I have a child, they have measles, or I think they have measles. What should I do? And they will give you instructions where to enter, so that we don't, again, expose a lot of people who might be very vulnerable to these types of infections, and try to get people in and the medical care that they need without that mass exposure.
And are there things that we can do for home care to kind of help with those symptoms while you're in that process of quarantine and recovery?
Yeah, fortunately, the rash is not itchy. It looks bad, but it is not typically an uncomfortable rash, unlike chickenpox. It's a lot of just fever control. So whether that's Tylenol or ibuprofen, whatever your child's age and health conditions says is okay, and always talk with the pediatrician too if you're not sure. But besides fever control and making sure people stay hydrated, it's really just watching out for those potential complications. We talked about pneumonia as a dangerous complication, but diarrhea can happen in about 10%, and ear infections actually happen not infrequently as well. So just sort of watching out for some of those other things. As long as the kid is eating, drinking, staying hydrated, and doesn't seem to be developing any complications like respiratory complications or ear pain, then I think it's worth just watching them at home.
Okay. Any other thoughts as we're navigating measles in 2025?
I mean, I think the biggest thing is to make sure that your family is vaccinated, especially if you're traveling outside the U.S., where there are a lot of cases of measles, where vaccination rates are even lower than they are in the U.S. So make sure that the family's up to date on their vaccines, and then just being an advocate as well to your parent circles and your children's friends, just sort of talking about the benefits of it. I think that peer-to-peer, you know, hearing something from another mom that, your kid got vaccinated and they're doing well and it was fine and easy and something you're glad you did. I think that goes a long way. I mean, we talk about physicians being influencers in that way, obviously, and trusted sources of information, but also other parents can influence the decisions of their peer group. So don't be afraid to talk about how you are a parent that vaccinates, and don't be afraid to talk about how it's important for other people to do it, and maybe just people hearing it over and over just a little bit at a time will be enough to change some minds.
So thank you so much. I appreciate all the time this morning.
Yes, you're
Great.
very welcome.